Now, I want to also look at another type of physical examination that is done for a patient, and this physical examination is done before the operation. So before you go into a surgery, you are trying to assess the patient and see. Okay, so for this physical examination, what are the things you'll be looking out for, and what are the likely things you'll see? So first of all, you have to get the patient's general information. So you have to identify that, okay, this is the patient I'm actually supposed to, examine. Okay, so patient identification, planned type of surgery, type of anesthesia they want to use, allergies, current medications, all of that you should be aware of it. Then you take your vital signs like the blood pressure, heart rate and rhythm, respiratory rate, temperatures, then oxygen saturation. You take all of that. Then general appearance. This is where you look at the level of consciousness of the patient, look at how they have been feeding, look at signs of distress. Okay. Then systemic examination. This is where you look at the cardiovascular aspect, heart sounds aspect, murmurs, rhythm abnormalities and all of that. Then in the respiratory system, look at their breath sounds. Is there any signs of any adverse, or those COPD, asthmas or infections? Then access their airways. Okay. In the abdomen, you look at if there's any swelling in any organ. Okay. Then especially signs of liver disease. In the nervous system, you look at their mental status, if they've ever had any histories of seizures, stroke or neuropathy. Then the musculoskeletal system, you look at how they are able to move, the deformities, spine abnormalities, none of that. Then on the skin, you look at the integrities at the surgical side, you look at if they have rashes, look at if they have ulcers, look at if there's any infections on the skin and all of that. Okay, so these are things you shouldn't miss out for before this patient goes in for surgery if you're trying to examine the patient.